So in a nutshell, when people develop cancers, there is often an immune response initiated by the body. And sometimes that immune response is very effective, but also sometimes cancers are very clever and they hide from the immune system. They use proteins, we call them checkpoints. So if you can imagine, our own tissues, our own body does not want to be attacked by the immune system. And so we have these checkpoints on our own cells, and the cancer uses the same checkpoints to prevent itself from being attacked and recognized by the immune system. And in essence, what immunotherapy does is that it blocks these proteins and it enables that immune response to be more active, and thereby allowing the immune system to attack and hopefully kill some of those cancer cells. Immunotherapy is safe for many people. Up to about a third of patients will have very few or no side effects. But in a small proportion of patients, there can be more severe side effects. But on the whole, it tends to be safer and easier for the person to cope with than chemotherapy. The reason why people get side effects from immunotherapy is because your immune system can sometimes start to cause inflammation and attack healthy tissues as well. And we call these autoimmune side effects. But in most cases, we are able to manage these successfully. And for most patients, we can then reverse those side effects. But occasionally, they can be much more severe, and therefore we have to stop the treatment, as that will be the safest thing to do. So it's not too different in most cases. The main thing about immunotherapy is that sometimes it can take a little bit longer for us to see the full benefits. If you compare to something like chemotherapy, we have fairly standard readouts of these trials. So a patient's on a treatment for a certain amount of time, then they get a scan after 6 weeks or 12 weeks. And then if the tumor shrinks, then that means that the person has responded to the treatment. Obviously, if they also derive clinical benefit, in other words, an improvement in their symptoms, that's also important. With immunotherapy, we are looking at similar endpoints, but sometimes it can take a number of months and sometimes even several months to see the full benefits. And so a lot of clinical trials are designed to reflect that. And so we may not get those important readouts very early on with immunotherapy, which is why sometimes we, even if it looks like the tumor might be getting bigger or hasn't changed much, we may decide to continue with the treatment, especially if the person isn't having too many side effects from it and there's no obvious clinical deterioration in their condition. Well, that's obviously an individual choice. Most clinical trials are conducted for the benefits of patients, but there are different types of trials. So, for example, there are some trials where you would get a treatment and it would be compared with standard of care treatment, and some clinical trials are just looking at individual drugs to see what effect that might have on you as an individual, but also more importantly, what sort of doses you can tolerate. So I think it has to very much be an individual decision. The advantages of taking part in research are that you are not just helping yourself potentially, but also helping the wider scientific community and people in the future. The disadvantages might be that you may end up getting a dummy or a placebo in the trial, or you may not get benefit from the treatment, and therefore you might have to then move on to something else. You are monitored more closely when you're on a clinical trial in most cases, but that can also lead to some more inconvenience for you because you might have to have extra hospital visits, extra tests, extra biopsies. And so whenever someone is deciding to take part in the trial, good practice would be to ensure that that person fully understands the trial and has some time before they make a decision about whether they wish to participate. So most immunotherapy treatments are given intravenously, so either through a cannula or sometimes a line. And they vary. Some are given every 2 weeks, some 3 weeks, some 6 weeks, depending on the drug that you receive. The infusions usually don't take very long, maybe an hour or so. And most people feel well during the infusion, and it's done as an outpatient basis or sometimes in the comfort of your own home. The treatment is then continued And for many immunotherapy treatments, is continued for as long as the treatment is benefiting that person, or for as long as they don't get any unacceptable side effects. Sometimes it's a course, but more often than not, it's continued. The person who's having the treatment would require to have blood tests intermittently, just to check that all their parameters are normal and that it's safe for them to carry on with the treatment. And then every roughly 12 weeks or so, depending on the treatment they're receiving, they would also have a scan to see whether the treatment is benefiting them or not. And they would have regular consultations with their oncologists as well. So that can vary. Some patients get immediate benefit, so within a few weeks, but more often it takes a number of weeks or even several weeks to see the full benefit. And occasionally, depending on the type of tumor and the type of immunotherapy, it can take 3 or 4 months before people see some benefit. And when I say benefit, that hopefully would mean an actual reduction in the bulk or the size of the tumor, but also an improvement in someone's symptoms, an improvement in their well-being. And in many cases, we might just see a stabilization of the disease where the cancer stops growing. And that for us, as long as the person themselves is well and they don't have too many side effects in the treatment, that is also a good and successful outcome of the treatment. So that does happen, unfortunately, and there may be a number of reasons for that. It might be because their particular cancer isn't a cancer that's going to benefit or respond to the treatment, but also sometimes the treatment can work and then stop working, and that's very common because people develop resistance to the disease. At that point, the person who's receiving the treatment will have a consultation with their oncologist, who will hopefully explain what's happening and then discuss other treatment options. And that might include things like chemotherapy or other targeted therapies, or possibly participation in clinical trials. There's a lot of research going on at the moment in trying to find out why certain immunotherapies why some patients are resistant to certain immunotherapy treatments, and also why resistance develops. So your oncologist would either be able to offer you those trials if they happen to have access to them, or refer you to someone who could, if that's what you would like to do.